Hello, everybody. This is Mala Ramakrishnan. I'm the founder and managing partner of Progressive Ventures. I'm thrilled to have with me Cheong Ang. He's the field CTO from IBM. He was previously co-founder at LucidAct, and he's completely transformed my perspective on healthcare just by listening to him and learning from his background. So welcome, Cheong.
Oh, thank you, Mala. Thank you for having me. Great to be here. It's a privilege for me to be able to talk to the audience, right, wherever you are and whatever life stage you are in and whichever goals that you're pursuing. Because to me, I just love to help enable other people.
So tell me more about your dive into healthcare. How did you come about starting to work in healthcare as an industry? And then you've led innovation for a couple of decades in healthcare.
Oh, thank you.
So what's the transition that's happened all those years?
It might be the kind of, I guess Asian parent stories that we're sharing with each other, right? A lot, right? So I kind of started out, my parents expected me to be a doctor, of course. So in university, I started as a pre-med, but then very quickly, I just found out, hey, the computers are doing wonders, right? Maybe it's a little bit of ADHD side of me. I just need this instant gratification. And so with that, I actually ended up pursuing bioengineering as my bachelor, and that's how I graduated and then got into the computer side. But my first job was at UC San Francisco Health. So that is a healthcare organization, as many of you may know, and that pulled me back into healthcare. And then when I was at IBM started Healthcare Life Sciences Division, and that's also my home as well. So those backgrounds just line me up for healthcare, and has been, I would say, half of my career has been in healthcare.
In healthcare. And
Yeah.
it's amazing that you must have seen the digital transformation pick up and carry through in these couple of decades. So what has happened in recent times?
In terms of healthcare and technologies, a lot of things have changed and a lot haven't. And obviously, back in those days, you got digitization of health, right? Which is probably, I would think the later part of 2000s, right? Maybe 2008, 2009 or so, a lot of, I guess, paper records come online. And that got the first big boost, and that unleashed a lot of capabilities that previously not available to the healthcare systems. And then, of course, in parallel, we saw the AI track going on, right? Yeah. 2012, 2017, you got the GPU enabled, I would say, well, don't want to say big data number crunching, but yes, roughly that's what it is. And then 2017, transformers. And so a lot of things are all coming together. But the part of healthcare that hasn't changed very much is, it's still a very people-oriented business. You still have providers, you still have workflows, you still have guidelines, regulations, everything has to follow. Right?
Yeah, and that brings me to the next question, which is, in such a heavily regulated industry, how do you support innovation?
Yeah, carefully, I guess, and keep trying. I would say those are the two things. And for many years, you probably have seen healthcare organizations starting their innovation centers, right? It's pretty much all the large healthcare organizations out there. And then you might have heard about, I guess, the unfortunate evolutions as well of a lot of trying, but not a lot of rolling out, right? So that's a kind of hump to cross over in terms of, keep trying technologies, but then you got to round up the people and process side of the operations themselves.
Yeah, I think the beauty of innovating in a regulated industry is that you can actually have a massive impact if you succeed. And I'm just inspired by your founder journey as well. So at LucidArt, you started a company as a co-founder and had 40,000 patients. That's pretty phenomenal. So tell me about your journey there. What was the pain point you were solving, and What was it like starting a company in healthcare and running it for a few years and seeing that kind of traction?
Sure, sure. I'll share what I can, and to the extent that I know about LucidAct, right? So I have been with LucidAct for 4 years, being a co-founder, CTO as well. But I've since then left LucidAct, right? So yes, it started out with the problems that I've seen at UCSF Health and also San Francisco General Hospitals. Back in those days, we techies, we may have this idea of business process management, automating workflows, right? All those. And unfortunately, those things don't trickle down into like a clinic, to a specific patient, to the care coordinators, because, well, even though it makes sense, if you think about a patient, there's a certain pathways that they have to follow, right? If you have chronic disease, then here's what you do. Every year you do this, every month you do this, and you may have to measure or prick your fingers every day, right, for your H1C to be available. And then on the clinic side, then you have the care coordinators who are keeping track of a large number of patients, making sure that they call the patients up, scheduling them to come in. It's a process thing, it's a workflow, and it is very, very much a time-consuming manual type of task, especially for the providers who really care. They really want to make sure that they bring those patients in for the necessary care. And that got me thinking, okay, business process management, workflow processes, right? Can we just map out those guidelines, those care pathways? Care pathways, I would roughly say, each step in a care pathway is kind of like an interaction between the patient and the provider. And then a lot of things happen in there, right? That could be prescription, that could be a lot of notes taken, could be some, diagnostic results. So from that perspective, as a patient is journeying through the pathway, and as the providers are rendering the services, then that's a wealth of information that ended up, well, in those days, unstructured data or medical record systems, right? And then at the same time, the care coordinators would like to track those patients, would like to make sure that the services are provided, but the systems, the computer systems, are not doing its job to make sure that certain policies and guidelines specific to the clinic itself is being carried out, right?
But don't you think this is a problem that everybody starting from Oracle, BPM, and healthcare has been trying to solve? How is it that a startup gains so much traction in this? It's a tough industry. It's regulated. Healthcare is just a tough one to break in as a startup founder, I would think. How did you manage that? Like fight against incumbents who are massive, like an IBM and Oracle, and yet start a company to gain like 40,000 patients in traction?
So that's part of navigating, I guess the looking for the opportunities, right? It's part of the entrepreneur journey, if you will. The reason I even mentioned BPM, right?
Yeah.
Is because if you think about it, those systems, those solutions would cost millions.
Yeah.
And then we're talking about this little clinic and their workflow processes.
Oh, so you played a price game then.
So they don't get there. They are too small.
I see.
Right? I mean, FedEx may spend millions, right, on the logistics building BPM out.
Yeah.
But, well, the hospitals is not going to spend millions to take care of a specific group of care coordinators.
Care coordinators, right. Got it. Yeah, I don't know if you know, my background is from Oracle, BPM, and TIPCO, and
yes, I do. So that's why I'm talking about BPM. And
I used to work on the Beeple engine at BEA.
You do work with Automation Anywhere as well.
Automation Anywhere. Yeah. So yeah, we have a lot in common, I guess. And it's interesting. I think the new founders today are not aware of this old middleware technology world that we've been trying to solve the same problem for the last couple of decades. And they come in with a fresh pair of eyes, which is awesome. but then they're trying to solve the same old new. And so, what's your feedback to entrepreneurs today who are trying to make a break into healthcare and get started with automation of these processes? That's, I mean, what else could you do in healthcare?
Yeah. So the story that doesn't end over there, right? So with those automation not being available,
Yeah.
so that creates a problem. And so back then, I was trying to, okay, let's just manually map out, and then have that codified, right, into something that a system can carry out. And then so that ended up to be the LucidAct platform.
I see.
With the 40,000 patients that you mentioned, right? And then, but we have to wait for the other side as well to happen, right? Which is monetization.
Right.
So how is there a business model that supports it? Yes, you're doing great work, right? Helping this group of people, the patients, the care coordinators, the providers, but if no one is paying for it, it's not sustainable. Then there comes in 2015, Medicare kicks off this CCM, chronic care management program, to pay for non face-to-face visits, and that kind of gave LucidAct a break. And in a way, LucidAct kind of started out the journey together with the Medicare CCM, right? It's a 99490 charge code. But then, of course, you got to give Medicare a little time as well to grow, and that's why it takes time for LucidAct to grow as well. Because the announcement of availability of the fund doesn't mean it's instantly deployed, and doesn't mean all the providers are taking on them immediately. And so back to the question of founders. So if you look into healthcare, I imagine it's still true today, even though that was quite a few years ago. It's still going to be a people process type business. So you provide a technology, you got to think about people process. And then it's still going to be something has to be there to pay for the benefits that you're trying to bring to the patients and to the providers. And I mean, in terms of those innovation standards that we're talking about at healthcare organizations, so they think about, let's kick the tires on this to understand the benefits. And then that's always the next thing that comes to mind. Great, the POC is successful, and how do we disseminate the innovation?
Right.
And how do we make it sustainable? So those will end up to be what you're thinking of as well as a founder, right? Because, well, it's nice to do a POC,
right?
But then it's nicer, right, if you also have a stream of revenues coming in that helps you sustain and grow your company, right? And then a lot of times those don't
line up easily,
don't line up easily and don't grow with the expectations of your investors. So you got to look at all those different external factors, like the Medicare type factors, right, that affects how your company would be growing.
Right. Yeah, I think it's a lot like building products in privacy engineering, where if you're like, always trying to stay ahead of just regulatory acts, or government laws that are being passed, it's kind of hard to be at the cutting edge of innovation and really driving monetization. Now, when you're switching gears into IBM, now you've like made this transition from being a startup founder into a massive company. Not too many people are capable of that. How are you, what is it about you that's made you so successful?
I guess startup into a larger company, I would imagine is about getting specific on what you do, right?
Yeah.
And sometimes you may feel, I think it's got its pros and cons, right? It may not necessarily be that, I don't have all this power of influence anymore because, I don't touch all these different things in my startup, right? But then on the other hand, you may appreciate the other side. Oh yeah, there are always these other people
taking care of you.
Yeah, I just call them and they'll do it. Right? And so yeah, it's pros and cons, and that allowed me to focus more specific on what I want to do. But then at the end, if there's an alignment, as I was kind of kicking off the talk about, if I can enable other people to achieve what they want, and then I look at it from that lens, then what happened is, oh, okay, if I do this, if I call this person up and then bring, good information to them, provide them with support so they can go forward and achieve great things.
Yeah.
That is sales, right? That is being a trusted advisor. And that's the kind of things that is still the same in startup or in a large organization. So,
and even at IBM, you've done incredibly well. I saw your numbers saying you save $90 million a year for your customers.
So there's a specific healthcare system. They were using a piece of optimization software from IBM, right? And that allows them to generate schedules based on the demand of over 1,000 clinics and 52 hospitals. And then with that kind of volume, it saves a lot of providers, especially from the nursing managers, nursing supervisors standpoint. Otherwise, those people will be spending hours just to create each schedule. And with this, number crunching, ML, AI, if you will, right? Looking at all the demands, looking at the patient volume, looking at the specific policies and regulations that they have to follow. Like, if you have this number of patients coming in, how many providers do you need to have, right? And if you have a certain providers working a certain number of hours, they need to take breaks, right? So all those kind of things are all being considered in generating a, I wouldn't say perfect, but optimized, workable schedule automatically, right? And then that takes, seconds versus a couple hours.
Wow, I see. And so they're cutting costs by scheduling people better. So are they saving license costs, or are they firing people, or how are they saving those costs?
During that time frame, there's actually a nursing shortage. It's not even about cutting, right? It's about you're not able to find those people. And yes, going back to optimizing schedule, you got to look at availability of people, right? The preference of the work, right? And then so that actually helps with nursing shortage problem. And perhaps it's not, those two numbers, right? Patient care hours, yes, you free up a lot of hours, right, from the perspective of providers working. But at the same time, the hours have roughly two different rates, if you will, right? Because one is traveling nurses hours, which is kind of contracting, if you will, right? And those are 3 times higher than a person who is on your staff.
Right. So what area of healthcare do you think is still underinvested?
I think, when you think about AI today, we all experience the convenience of, typing of questions, and then, you provide as much context as you want, right, into something like a ChatGPT, and then you get some answers back. And yes, you read it, and some of it you laugh at, right? But that's not some flexibility you have in healthcare, especially you go beyond administrative workflows. And so a lot of solutions that come out would be targeting this less mission critical administrative workflows type situation. And maybe they try to provide diagnostics help, right, in terms of decision support. But what is more important, and you can ask any providers, they think about this actual patient outcome. And, with chronic disease patients, then you're talking about sometime down the road, right? And then a little closer would be adherence to treatment. And then, that's this buzzword, personalized medicine being more effective as well. And those are the kind of things that in their mind. And then a lot of studies have been done, right, using different tech tools to achieve those. But when you think about our current AI, the directions that we're going, we're talking about, yeah, this is a piece of tech that changes all the time.
Right.
Because it's a model and you can fine tune the model.
Yeah.
Then you feed it data, then more fine tuning, right? Then it works better.
Yeah, yeah.
So that, yeah, it's kind of a little inconsistent with what we're talking about, even from the perspective of doing a study based on a piece of tech, right? Well, to begin with, there's already people and process involved in that as well, right? And then the tech is changing all the time.
Yeah, yeah.
And at the same time, is all these guidelines and regulations and,
yeah,
as you point out, the privacy and security.
And there's the ethics and responsible angle.
Ethics and responsible. So all those things have to come together.
They all have to come together.
And I mean, one study is great, but it's only on a specific set of parameters of this whole solutions that we're talking about. And AI is great because it allows you to explore all the different things. But I think scalability wise, this kind of study is just not scaling together with our thinking of this constantly evolving technologies.
So switching to your personal side, what do you do for fun? And is there a favorite book that you would recommend to our audience?
Sure. Well, believe it or not, right? I do ballroom dancing.
Oh, wow.
I play tennis.
No wonder you look so fit.
I do like skiing.
Uh-huh.
And the book, I think, yeah, the book actually applies to me personally and to business as well. Atomic Habits.
Atomic Habits.
Yeah, James Clear, right? So, when you think about from health standpoint, waking up in the morning, doing 10 minutes of exercise, right? A little bit of strength and other things, that helps. I've been doing that for years, right? And then talking about learning, if you spend your morning time reading something as you're having breakfast, you will be surprised over time how much more you know. And then the third piece that I would say it applies to as well is this whole connection. So if you're thinking about, okay, I'm going to have in my habit reaching out to certain people, just reaching out to a number of people in a week, right? And you set that as your goal, and then you do that, and then you get better at it over time as well, and you will be surprised how you evolve the relationships and the trust.
That's right. Yeah. Well, we met at a networking dinner I hosted. So
absolutely.
And I'm totally with you on that.
That gets me here talking about
in my house.
all the stuff.
Well, thank you so much, Cheong. Any last words for our founders and for our audience?
Any last word? I would say, AI is going to be very much changing our lifetime, the way that we're going to live, right? So it goes back to keep learning and keep exploring, and at the same time, make sure we understand that we're here for other people, right? So if we can help other people, enable them, and yes, this servitude, right, is so important, then together we're gonna, I guess, we're gonna evolve the world into a better place for all of us.
Wonderful, really amazing nuggets. Thank you so much.
Yeah. Thank you, Mala.